Sessions will come to order. This morning, we will be considering three bipartisan bills. We're going to debate each bill and then stack all votes at the end. And let me start off by thanking each of the bill's sponsors for working on these important policies and to all the staff for working together to prepare these bills for our markup today. The first bill that we will consider is S-4776, legislation to reauthorize, expand, and improve the Older Americans Act, which I have introduced with Ranking Member Cassidy, and it's co-sponsored by Senators Casey, Collins, Kane, Mullen, and Markey. This legislation has been endorsed by the AARP, Meals on Wheels America, the Elder Justice Coalition, and the National Association of Nutrition and Aging Services Programs, among many other groups. And I would ask unanimous consent to include all of these support letters in the record without objection. This legislation begins to pay attention to the urgent unmet needs of millions of seniors in our country and what we should do as a society to reduce the senior poverty rate, to reduce senior hunger, and to improve the health and well-being of some of the most vulnerable people in our nation. Specifically, this legislation would authorize an increase in Older Americans Act funding from $2.3 billion this year to $2.76 billion in fiscal year 2025, a 20% increase in funding compared to last year, $450 million more in funding. Over the next 5 years, this legislation would authorize the Appropriations Committee to spend 44% more on the Older Americans Act than it currently does, taking funding levels from $2.3 billion in 2024 to $3.3 billion in 2029 for a total of $15 billion. When we talk about the unmet needs of our nation's seniors, this is what we are talking about. In America today, 12 million seniors are dealing with food insecurity and are worried about not having enough food to eat. Nearly a quarter of our nation's seniors are considered to be socially isolated, and more than 1 out of every 4 seniors suffer from tragic falls, the leading cause of death from injury among our elderly population. Nearly 95% of adults over the age of 60 have a chronic health condition, and 80% have 2 or more chronic conditions like high blood pressure, arthritis, or diabetes. Seniors throughout our country, particularly in rural areas, lack the transportation they need to get to a doctor's office, the grocery store, or the dentist. That should not be happening in the United States, the richest country in the history of the world. Now, here is the good news. We have a very effective piece of legislation on our books to address these needs, and that is the Older Americans Act. As we all know, since 1965, the Older Americans Act has provided federal funding for many essential services for our nation's seniors, including helping them live at home, preventing loneliness and isolation, preventing disease, supporting job training, protecting against elder abuse, and providing rides to the doctor's office and grocery store. Perhaps most importantly, about 45% of funding from this legislation is used to provide meals to millions of frail and isolated seniors through Meals on Wheels and congregate meal programs at senior centers. The good news is that over 2 million seniors receive nutrition services each year under the Older Americans Act. The bad news is that due to a lack of funding, roughly 4 out of 5 seniors who need a home-delivered or congregate meal do not receive one, and many are put on waiting lists that can last for several months. That is something this legislation begins to address. And let's be clear, not only does the Older Americans Act save lives and ease human suffering, it also saves money. In fact, it costs less to feed a senior for an entire year through the Older Americans Act than it does for a senior to spend one night in a hospital. Providing adequate nutrition services for seniors also reduces the need for nursing home care. In America today, the median cost of a private room in a nursing home is over $100,000. Unfortunately, funding for the Older Americans Act has gone down by nearly 20% after adjusting for inflation and population growth since 2016, even though the demand for its services have gone up. This legislation we are marking up today would begin to reverse that trend. This legislation also strengthens our nation's senior centers, makes it easier for seniors to receive routine health screenings to detect and prevent chronic health conditions, provides more resources to our nation's home health care workers, takes important steps to prevent social isolation and loneliness, expands access to nutritious meals for our seniors, and begins to address the serious mental health needs of many of the elderly. Well, I believe there is much more that we must do to reduce the senior poverty rate in America and to make sure that every senior in the country has access to the services they need. This bipartisan legislation is a very good and important step forward, and I want to thank all of our colleagues who have come together in a bipartisan way to make this happen. Senator Cassidy.
Thank you, Chair Sanders. Today, the committee considers reauthorizing multiple programs providing health and social services to Americans. This includes reauthorizing the Older Americans Act, or the OAA, legislation which empowers an American senior to live a healthy and independent life in the setting that they choose. First enacted in 1965, the OAA provides funding to support essential services to aging Americans through things such as nutrition assistance, caregiver support, and elder abuse prevention. Now, this program has traditionally been reauthorized in a bipartisan manner, and it strengthens its support for seniors every time. Now, it is our responsibility as a committee to examine and evaluate the efficacy of the existing program, to see where we can improve it, to make sure that taxpayer dollars are used effectively. It is good that this committee is fulfilling this responsibility today. I want to particularly thank the members of the working group who were so effective at working through those thorny issues to make this a bipartisan product. And I will call out Chair Sanders, Senators Collins, Braun, Mullen, Casey, Kane, and Markey, again, for their work to improve the OAA in a responsible bipartisan fashion. I also want to highlight the work of other committee members and senators who contributed policies, specifically Murkowski, Marshall, Romney, Budd, and Rubio. Our bill reauthorizes crucial nutrition programs providing meals to seniors and also disease prevention and health promotion programs. Additionally, the bill strengthens the aging network by improving program integrity, transparency, supporting the development of state and local capabilities, and encouraging innovation and flexibility within the OAA programs. In addition to OAA, the committee is considering the Autism Cares Act of 2024, led by Senators Collins and Lujan. I smile because there's a woman, a doctor friend of mine, who's been texting me about this. I can tell her, don't worry, Elizabeth, we've addressed the issue. The legislation authorizes research and public health programs to better understand and address autism and other developmental disabilities. It also supports provider training and the development of diagnostic tools and evidence-based interventions. The committee is also considering legislation to reauthorize traumatic brain injury, or TBI, programs. This is led by Senators Mullen and Casey. Specifically, the bill identifies and addresses gaps in TBI data that highlights populations with higher risk of TBI. It also reauthorizes the Administration for Community Living Grants to states for TBI rehabilitation and other supportive services. I specifically highlight and thank Senator Mullen for his dedication and work on this issue so close to Senator Mullen and his family. Again, I thank Chair Sanders for today's markup and to my colleagues for your collaboration. I yield.
Thank you, Senator Cassidy. And as Senator Cassidy mentioned, after we finish with the Older Americans Act, we're going to go to the Autism Cares Act, led by Senators Lujan and Collins. Then we go to S4755, the Traumatic Brain Injury Program Reauthorization Act, led by Senators Mullen and Casey. Let's now begin consideration of these three bipartisan bills. I would appreciate if my colleagues could limit their remarks to 2 minutes. We will now consider S4776, the Older Americans Act, Reauthorization Act of 2024, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye.
Aye.
Those opposed, no. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on or offer amendments to S 4776?
Mr. Chairman?
Yes, Senator Casey.
Mr. Chairman, thanks very much. I want to thank you and Ranking Member Cassidy and others in the working group for working so collaboratively to reauthorize the Older Americans Act, or OAA as we refer to it. As Chairman of the Senate Aging Committee, I'm proud to have been part of the working group and pleased that this bill was negotiated on a bipartisan basis. The bill includes important supports for the Long-Term Care Ombudsman Program, a critical program that advocates for the interests of long-term care residents. The bill also provides critical support and guidance for grandparents raising grandchildren and enhances flexibility for nutrition providers, allowing innovations that were developed during the COVID-19 pandemic, like grab-and-go meals and other innovations, to continue to operate. These are important steps to improve the lives of the nation's seniors and their families, but our work is not done. Today's bill provides increased funding over the next 5 years, but the number of older adults across the country is increasing very rapidly, and we need to do more to serve them. Without robust funding, we cannot expect the aging network to continue to provide for older Americans as they have historically done. Additionally, I'm concerned that some of the changes to nutrition programs might undermine the dedicated work of local service providers. But in the spirit of the bipartisan agreement, I'm not offering any amendments today. I'm hopeful that as this bill moves forward, we'll continue to have conversations around increased funding and bolstering the nutrition programs to ensure we are comprehensively meeting the needs of our nation's older adults. I look forward to continue to work with my colleagues to ensure we're passing the strongest version of this reauthorization as soon as possible. Thank you, Mr. Chairman.
Mr. Chairman,
Senator Braun.
I was going to introduce a few amendments, but have decided not to, but I do want to make a brief statement about the bill itself. As ranking member of the Senate Aging Committee, we put a lot of work in on this issue. In the bill itself, we'll have up to 7 provisions that make this a great bill. A lot coming from that committee. My staff worked diligently on this, and I want to give them credit for fleshing out most of this. This was done in a bipartisan way. These provisions that we put in there are aimed at improving services for seniors by increasing flexibility, efficiency, and transparency. It empowers area agencies on aging to engage in business contracts, codify nutrition innovation, and allow health promotion programs to be evidence-informed, helping rural seniors. It also includes proposals to support older Americans by increasing long-term care transparency. It's so important in anything, protecting seniors facing guardianship and expanding access to broadband. Finally, work to increase transparency of the functions, funding, and performance of OAA's resource centers. This bill has got a lot in it. Many have contributed to it, and it's one of the things that makes this job a pleasure to see something like this go across the finish line.
Thank you, Senator Braun. Further discussion? Senator Murray.
Thank you very much, Chair Sanders. 60 years ago, the Older Americans Act enshrined into law our responsibility for helping seniors live healthy, full, and independent lives. With this year's reauthorization, we have a bipartisan opportunity to recommit to that mission and strengthen this critical bill, which serves so many people. I'm very proud to say this reauthorization includes many steps to help make that happen, and it supports not just older adults, but also people with disabilities and their families. I worked hard to make sure this bill would increase access to assistive technology, things like wheelchairs, screen readers, hearing aids, and many other things that help our friends and neighbors and loved ones with disabilities live their lives and be meaningfully included in their communities, workplaces, and classrooms. I also secured language to require that each state's plan on aging include the Centers for Independent Living and Disability Networks. We have 7 of these centers in my home state of Washington, and consulting with them is a common sense way to connect more people to the care and support they need. Also, this bill strengthens support for the 13 area agencies on aging that serve Washington State, allowing them to expand services to more older adults. And I'm especially pleased we were able to make important strides supporting family caregivers and improving services for elders in our Native American communities. These are longstanding priorities for me and pivotal for folks in Washington State. My dad had MS when I was growing up, so I saw firsthand how hard that was on him and how things only got more difficult as he and my mom got older, and how that affected actually our entire family. So it's very personal to me that we make sure everyone in America has the support they need to age with dignity. I want to thank all of the colleagues who worked on this in a really collaborative and bipartisan way, and I hope everyone will join us today in voting to advance the Older Americans Reauthorization Act. Thank you.
Thank you, Senator Murray. Senator Collins.
Mr. Chairman, let me begin by thanking you and the Ranking Member Cassidy and all of the senators who served on the Older Americans Working Group for their dedication in reauthorizing this important legislation. Having co-authored the prior reauthorization of the Older American Acts with Senator Casey, I appreciated being a member of the working group, and I recognize how important it is to update OAA programs and services, which are truly a lifeline for millions of seniors. Maine has the oldest population in the nation, and our population of those age 65 and older only continues to grow. The OAA helps Maine seniors access services ranging from nutrition to caregiver support that Senator Murray just mentioned, to transportation assistance. I especially appreciate that this reauthorization includes an extension to the Raise Family Caregivers Act, which I co-authored with Senator Baldwin. 40 million family caregivers in the United States provide an estimated $470 billion in uncompensated long-term care. It is important that we not only recognize but also support these family caregivers. The bill also includes important changes that will help our essential area agencies on aging better serve those living with Alzheimer's. Finally, I'd like to highlight the Grandparents Raising Grandchildren Council, first created by a law authored by Senator Casey and I in 2018, which is also extended in this bill. Approximately 2.6 million children are being raised by their grandparents or other relatives, and it's important to address the unique needs of this population. This Older Americans Reauthorization Act represents a great bipartisan effort to better serve older Americans, and I congratulate all of you who have been involved in the effort.
Thank you, Senator Collins. Further discussion? Senator Murphy.
Thank you very much, Mr. Chairman. I wanted to speak for a minute on an amendment that I have that I won't be calling. For the record, count me as somebody who wished we were having some debate on amendments. I understand the difficult nature of the compromise, but I think it's often pretty healthy for us to sit and contemplate changes and amendments to these very big, important bills. But I wanted to at least speak to an amendment that I was prepared to offer that touches, I think, a very troubling development in our national meal delivery service. I know Senator Sanders is concerned with this, and other members of the committee are concerned with this prioritization of profit and the cult of inefficiency in our healthcare and social care systems today. Sometimes when profit is the only thing that matters, consumers benefit, but often not so when it comes to our healthcare system. The Meals on Wheels program works not just because it gets food to seniors, but because it connects a neighbor, a community member with that senior at home. The food keeps the senior alive, but it is often that socialization, that check-in, that daily conversation that actually has the biggest health impact on that senior citizen. But under our noses, what has happened to the rest of our healthcare and social care delivery system is happening in Meals on Wheels. Big for-profit national companies are coming in and gobbling up more of the market. These companies don't send somebody to deliver the meal. They just send the meal in the mail. Now, technically, that's cheaper. Technically, that's more efficient. But it robs that shut-in senior of a really important personal connection. And I think it speaks to this broader trend in our healthcare and social care delivery system in which all we care about is whiteboard efficiency. So I had an amendment that would give priority to local community groups who run much of our Meals on Wheels system but are losing share to national companies that are unashamedly in this business to make money. The biggest national for-profit Meals on Wheels provider is run by a former private equity CEO who makes no bones about the fact that he is running that company in order to make money, as much money as possible. So I think this committee should take steps to have this important conversation. I'll just share one last story. My kid doesn't have a pediatrician because we go to a pediatric practice in which whiteboard efficiency tells them that it's more efficient for us to just see whoever's available on that day. So we get quicker appointments, they make more money, the system is technically more efficient, but we don't have a doctor, a pediatrician that we can build a relationship with, that we can trust, an important part of being a parent. So I checked as I was getting ready for this markup the other week. My kid's pediatric practice is owned by Goldman Sachs. And so it makes sense that in order to make money, they're going to build as technically efficient a system as possible. Maybe we can't unwind Wall Street from pediatric practices, but we could have made a decision today to stop the beginning of a trend in Meals on Wheels from becoming the norm. I think Meals on Wheels works because we prioritize socialization, not just the efficiency of the delivery of the meal. And I hope it's something that this committee can talk about in the future.
Thank you very much, Senator Murphy. Other discussion? Elder McTuck. Senator Kane.
I want to thank the chair and ranking for prioritizing this markup, and I was very pleased to work with a bipartisan group to make sure we got here today. And I just want to mention 4 priorities that are really important to Virginians, but that I think are good advances in this authorization that I worked on in particular. Senator Braun and I worked on a piece that focused on an emerging trait with our AAAs, which is, as public funding has not kept pace with the need, many of our AAAs have gotten pretty entrepreneurial, and they're bringing in contract revenue in to help them supplement the services they provide. It's just that the statutory language about what AAAs can do did not make that an easy fit, and we want to encourage that entrepreneurial spirit and additional revenue, but we want to make sure that we're warding off conflicts of interest and things like that. So Senator Braun and I had a piece that sort of, again, encourages this trend, but puts some guidelines in place to make sure that the underlying integrity of the AAAs and the services they provide are maintained. Senator Casey mentioned the work that we've done together to improve the Long Care Ombudsman program. That's really important. Third, we have language to reauthorize the Direct Care Workforce Strategies Center at the Administration for Community Living that really focuses upon innovative strategies to try to bring more people into this direct care workforce. That's important. And then the last thing that I worked on in particular with Senators Kelly and Murkowski, and I want to thank them both, language requiring the GAO to review the supply, affordability, and accessibility of housing for seniors, which, I think we're all dealing with housing shortages in all of our communities, and it is impacting seniors in a significant way, and this bill will direct the GAO to give us some data so that we might be able to more appropriately tackle that need. I want to thank all colleagues for getting us to this place. It's a very, very important bill.
Thank you, Senator Kane. Further discussion, Senator Markey?
Yep. Thank you, Mr. Chairman. I want to thank you. I want to thank Ranking Member Cassidy for your leadership. I want to thank the other members of the working group, Senators Casey and Kane and Braun and Collins and Mullen, for their partnership and collaboration on this reauthorization. When President Johnson signed the Older Americans Act into law in 1965, he said that it was America's responsibility to ensure the well-being of older citizens for the benefit of the men and women who have done so much in this century to build an America which is just, decent, free, and a peaceful society. And we all remain committed with this bill to that sacred responsibility. And this reauthorization will help ensure the health, safety, and well-being of older adults. By passing this reauthorization, we will be taking a significant and bipartisan, importantly, step towards making sure seniors have access to healthy food, clean air to breathe, homes that are safer in the face of climate change. This reauthorization will also support older Americans, family caregivers. Senator Collins and I were speaking yesterday on the floor about her father with Alzheimer's, my mother with Alzheimer's. There's 7 million people with Alzheimer's in America right now. There'll be 15 million by 2050. So this bill starts to deal with that issue and talk about the need for the caregivers to get the help they need, because the families are heroes, but families need help, and we're talking about that in this bill. And they serve on the front line of our healthcare system, often to the neglect of their own health and well-being. And by expanding access to respite care and peer support and improving caregiving assessments, we will be helping caregivers provide the often unseen, uncelebrated support that many older Americans rely upon. For 1 hour a day, a visiting nurse came into my house to help my father keep my mother in the living room. And that 1 hour was to keep from my father every day. So he did it at age 80, 82, 84, 86, 88, 90. My mother never left our living room. But it was that one little bit of support every single day that made the difference psychologically for him, so that he could complete his mission, that he would treat her with respect. So that's really what I love about this bill today. It kind of expands the vision, lifts our gaze to the constellation of possibilities for what we can do for all older Americans in our country. And I thank you, Mr. Chairman, and I thank the ranking member and all the members working on this.
Thank you, Senator Markey. Further discussion? Seeing none, and once again, let me thank everybody. This has been a work of love on the part of many, many people who understand the importance of this legislation. So I thank everybody for their hard work on this. We're now going to move on to S4762, the Autism Cares Act of 2024, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye. Aye. Those opposed, say no. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on S4762, the Autism Cares Act?
Mr. Chairman?
Discussion. Yes, Mr. Lujan. Senator Lujan.
Thank you, Mr. Chairman. Thank you to you and to our ranking member for holding this markup today. I think we all agree that it's critical that we reauthorize the Autism Cares Act. Now, this bill's legacy is built on the back of parents and loved ones who have fought for their children. Their hard work led us to invest in programs to support research, train practitioners, and provide services, development, and monitoring. Autism Cares 2024 builds on those successes. Autism rates are on the rise. 1 in 36 children in the United States have autism. Due to research, increased training, and awareness spurred by the Autism Cares Act, children are being diagnosed earlier and are receiving services from trained providers. Early intervention is key, but so are long-term supports and services. I have spoken to parents and caregivers, and this also hits close to home. One of my staff, Buddy Abeta and his spouse Sarah, are the proud parents of a child with autism. Sophie was diagnosed at a young age, and her parents have fought for the resources that she needs. She's worked hard and thrived through it all. But as Sophie and other children with autism grow older, new challenges present themselves. Buddy has expressed a fear that so many parents of children with autism have. What happens to my child when I'm gone? This bill works to ease that fear. Not only does this bill emphasize communication and behavioral health needs, but it also expands research and development through services for the lifespan of these children. Now, this bill directs our brightest minds to find new ways to support them through adolescence, midlife, and all the way through old age. So one day, no parent will have to worry about their children after they're gone. Senator Collins, thank you for your partnership. I yield back.
Thank you, Senator Lujan. Further discussion?
Mr. Chairman.
Senator Collins.
Thank you, Mr. Chairman and Ranking Member Cassidy, for including this bipartisan Autism Cares Act on our agenda today. I've been very pleased to work with my friend and colleague, Senator Lujan, in introducing this reauthorization. Like many people, I have a personal story involving autism. My husband had a child who was diagnosed with severe autism at a very young age. His son was never verbal. He sadly passed away, but I know how difficult it was. This bill will continue the successful programming across HHS that helps us better understand the causes and the symptoms of the autism spectrum disorder and improve the lives of families affected by it. I also want to take just a moment to recognize our former colleague and friend, the late Senator Mike Enzi, a former chair of this committee, for his steadfast leadership on this law. He was a true champion for the autism community. The Autism Cares Act is the cornerstone of federal autism policy, but it's set to expire at the end of this fiscal year. Reauthorizing this important law is critical to expanding research at the NIH, supporting the CDC's effort to increase public awareness of ASD, and strengthening and expanding HRSA's workforce training to identify and support children and youth with autism as well as their families. The workforce training includes supporting leadership education and neurodevelopmental and related disability programs known as LEND at universities across the United States. The Maine, New Hampshire LEND program at the University of Maine and the Maine LEND program at the University of New England in Biddeford, Maine, are doing such important work to serve individuals with the ASD in Maine. So I want to thank Maine and Maine, New Hampshire LEND programs, the Autism Society of Maine, the Maine Developmental Disabilities Council, Disabilities Rights Maine, and Adopted Foster Families of Maine for their advocacy on the Autism Cares Bill. And I would urge all my colleagues to support the Lujan-Collins bill.
Thank you, Senator Collins. Further discussion?
Mr. Chairman?
Senator Casey.
Very briefly. I wanted to thank you and the ranking member, as well as, of course, Senators Lujan and Collins, for your work on this, and for also including a provision on improving access to communication tools for people with autism and other developmental disabilities in the Autism Cares Act. I had legislation, the Augmentative and Alternative Communication Centers of Excellence and National Technical Assistance, or ACCENT Act, which would create a network of technical assistance centers to increase access to and highlight the need for augmentative and alternative communication. access to augmentative and alternative communication devices and procedures is essential to thousands of people with autism, and this provision gets us one step closer to that goal. Thank you.
Thank you, Senator Casey. Further discussion? Seeing none, we will now move on to S4755, the Traumatic Brain Injury Program Reauthorization Act of 2024, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye. Aye. All those opposed? The ayes have it, and the motion is agreed to. Are there any members who wish to speak on S4755?
Chairman.
Senator Mullen.
And I'll try to be as brief as I can, but it's going to be a little longer because this is a personal story about my son. I'm very involved in traumatic brain injuries because of my son, Jim Mullen, who now wrestles at Oklahoma State at the age of 20. But at the age of 15, he had a traumatic brain injury, which led him to not even be able to walk, not be able to touch his nose, not be able to read, write. And at the time, he was a high school and freshman, nationally ranked, had wrestled all over the world for the junior world team. We knew something was wrong with Jim. And we had taken him every place. He'd been wrestling since he was a little kid and was absolutely amazing at the sport. But something just wasn't right. And we didn't know what it was. We'd sent him to several concussion specialists. We ended up getting referred to the Cleveland Clinic. And this is no backhand to the Cleveland Clinic, but the truth is if you speak to 12 neurologists, you'll get 12 different opinions. And we went to the Cleveland Clinic, spent 2 weeks at the Cleveland Clinic. And at the end of it, their conclusion was that it was in his head. Not in his head, like in his head, but mentally, they said, this is what the neurologist showed us, that this is his way of telling us he doesn't want to wrestle anymore. Well, we never pushed Jim at wrestling. Jim loved wrestling from the day he first stepped on the mat at 6 years old, and he never stopped it. He was the kid that was always looking for practice, wanting to go to practice, walked out of practice, and all the other kids would be crying, and you'd ask Jim how he was doing, and he'd say, oh, Dad, I loved it. And so we knew it wasn't right, but we said, well, okay, if it's nothing with neurology saying nothing's wrong with him, then we're going to go ahead and let him wrestle. Well, literally 3 months later, he's wrestling at Newton, Kansas. He gets hit in the head. I'm coaching, and he walks over to me, and he says, Dad, I don't feel good. And he looked at me and collapsed. Coded, had severe oxygen depletion. We, of course, rushed him to the Wesley Medical Center at Wichita, Kansas, and he's in the pediatric ICU there, and he woke up 26 hours later. He didn't know who he was, didn't know his name, didn't know who we were, knew we were somebody, but didn't know who he belonged to, didn't know what year it was. The only question he got right, and this is no political joke here, was who the president was. He said Trump. And, of course, President Trump found that hilarious. And then he started testing him. And they had him just do simple touches. And the issue was that he couldn't touch his nose. And then they got him up to walk, and here's an elite athlete, and he was shuffling his feet and had to put a safety belt on him. And the neurologists at the Wesley Medical Center told us, we'll go home and it'll eventually wear off. That's what we were told by the lead neurologist there. Fortunately, we got hold of the Center for Neural Skills in Bakersfield, California, and the founder of the place called Mark Ashley gave us a call while we were in the hospital, and he started asking for his medical records, and we started giving him all the medical records, and he said, has this happened, how long has this been going on? And he started hitting all the points, and the first time as a parent, it was like, we got somebody that actually got answers here. Well, what ended up happening was an 18-month journey for us being at the Center for Neural Skills and him learning every skill again. It's so hard to see your son that can't even put together a kindergarten puzzle. And before this happened, he was taking advanced classes in school, and not being able to hold a plank or be able to bring his feet up, and we couldn't. I mean, literally, doctor after doctor couldn't give us answers. They told us it was going to be 3 years of intense rehabilitation, and Jim's attitude was, he said, "Dad, I learned it once, I can learn it again." So he had a good attitude by it, right? I still have problems with it. I don't think I've ever quit crying over it. One of the hardest things that I've dealt with as a parent to see your kid go through this. They said he could never wrestle again, said he would never be able to play sports again. Of course, he's defeated odds. Like I said, he's wrestling at the University or the Oklahoma State University right now. But my point of all this, the reason why this is so personal, and Chairman, I appreciate you indulging me in so much extra time, is because there's so much more we need to know. And with this, with the reauthorization of the brain injury program, it gives families hope. It gives people the ability to have some place to turn. It gives researchers, those that are trying to dive into this, some more answers, because it's not the doctor's fault. It's not the neurology fault. It's not the Wesley Medical Center. It's not the Cleveland Clinic. I don't blame them. They did the best they could. It's just they did the best they could, and there's so much more that can be done. There's so much more studies that need to happen. There's so many more answers that need to be that need to be explained. Like, I didn't know a frontal lobe injury causes you for adolescents, that it stunts your growth. We had no idea that until we were 3 months into it. And 3 months into it, his growth plates is closed. So Jim's going to be 5'3" the rest of his life, which is fine. But it's little things like that. If you had the information ahead of time, you can make better informed decisions, which we didn't have. So I appreciate this committee working in this manner. Senator Lujan, I hate that you started it with an emotional, because you got me emotional before I even started, and I don't cry, I promise you. Actually, I do. But I do appreciate this committee working in a bipartisan manner, because this is something that's important to all of us. We've heard the stories around here. So thank you. Senator Chairman, we don't always get along, but in this, I do appreciate your attention to it.
Thank you, and thank you. I mean, this is what real legislation is about. It comes from personal experience, and we thank you very much, Senator Mullen, for sharing your own experience, and we wish your son the very best. Further discussion on the traumatic brain injury program reauthorization.
Mr. Chairman?
Senator Casey.
Mr. Chairman, I want to thank Senator Mullen. We're grateful to have worked with him and his team on this, and for his statement, and I'll submit a statement for the record. Thank you.
Thank you. Senator Cassidy.
I also want to thank Senator Mullen and Senator Casey for their work on leading this. And I also thank Senators Cornyn and Ernst, who work with the committee to make sure that the legislation addresses knowledge gaps for populations that have a high rate of TBI. It can happen to anyone. We see increasing evidence. It can happen to young people with sports, as Senator Mullen just spoke of. So the TBI Act reauthorizes these important programs, and I encourage my colleagues to support.
Further discussion? Seeing none, I would note the presence of a quorum, and we will now move to votes. We're going to begin with final passage of S4776. I move to favorably report S4776 as amended. The clerk will call the roll.
Senator Murray? Aye. Senator Casey? Senator Baldwin?
Aye by proxy.
Senator Murphy? Aye. Senator Kane? Senator Hassan? Aye. Senator Smith? Aye. Senator Lujan? Aye. Senator Hickenlooper?
Aye by proxy.
Senator Markey?
Aye by proxy.
Senator Cassidy?
Aye.
Senator Paul?
No by proxy.
Senator Collins? Senator Murkowski?
Aye by proxy.
Senator Braun?
Aye by proxy.
Senator Marshall?
Aye by proxy.
Senator Romney?
Aye by proxy.
Senator
Aye by
Tuberville?
proxy.
Senator Mullen? Senator Budd?
Aye by proxy.
Chairman Sanders?
Aye.
I have 20 ayes, 1 nay.
The ayes have it. The bill is agreed to and will be favorably reported as amended. We're now going to final passage of S4762. I move to favorably report S4762 as amended. The clerk will call the roll.
Senator Murray? Aye. Senator Casey? Aye. Senator Baldwin?
Aye by proxy.
Senator Murphy? Aye. Senator Kane? Aye. Senator Hassan? Aye. Senator Smith. Senator Lujan. Senator Hickenlooper.
Aye by proxy.
Senator Markey.
Aye by proxy.
Senator Cassidy.
Pardon me? Senator Mullen is there. Okay.
Senator Cassidy. Senator Paul.
No by proxy.
Senator Collins. Senator Murkowski.
Aye by proxy.
Senator Braun.
Aye by proxy.
Senator Marshall.
Aye by proxy.
Senator Romney.
Aye by proxy.
Senator Tuberville.
Aye by proxy.
Senator Mullen. Senator Budd.
Aye by proxy.
Chairman Sanders.
Aye.
I have 20 ayes, 1 nay.
The ayes have it. The bill is agreed to and will be favorably reported as amended. I now move to authorize staff to make any required technical and conforming changes with... Oh, I'm sorry. The next vote is on final passage of S 4755 as amended. I move to favorably report S 4755 as amended. The clerk will call the roll.
Senator Murray.
Anticipated the result.
Senator Casey. Senator Baldwin. Senator Murphy. Senator Kane. Senator Hassan. Senator Smith. Senator Lujan. Senator Hickenlooper.
Aye by proxy.
Senator Markey.
Aye by proxy.
Senator Cassidy.
Aye.
Senator Paul.
No by proxy.
Senator Collins. Senator Murkowski.
Aye by proxy.
Senator Braun.
Aye by proxy.
Senator Marshall.
Aye by proxy.
Senator Romney.
Aye by proxy.
Senator Tuberville.
Aye by proxy.
Senator Mullen. Senator Budd.
Aye by proxy.
Chairman Sanders.
Aye.
I have 20 ayes, 1 nay.
The ayes have it. The bill is agreed to and will be favorably reported as amendment. I now move to authorize staff to make any required technical and conforming changes when preparing S 4776, S 4762, and S 4755. All those in favor, please say aye. Aye. All those opposed, nay. The ayes have it, and the motion is agreed to. And that's it. Okay. Committee stands is adjourned.